Many families in America today fight with the disease Alzheimer's. According to the Alzheimer's Association, 5.5 million of people in the U.S. are affected by this disease. 5.3 million people are over the age of 65. Do you know someone with Alzheimer's? Don't be afraid of anyone with Alzheimer's. It can affect any one of us. Today I plan on informing you on a few facts about this disease, Alzheimer's. I want to inform people about Alzheimer's disease because on October the 7th, 2017, there will be a walk at Bonita Lakes to raise awareness for this horrible disease. First, I would like to tell you what Alzheimer's is and who discovered it. And secondly, I would also like to point out some of the symptoms that comes along with this disease. Lastly, I want to tell you how or if this disease is treated and if there's any medication or any therapy that can help a person live their daily lives. I found out some information on Alzheimer's that may interest many of you. I know it did for me. This disease is a progressive disorder of the brain, which normally starts with our short-term thinking, short-term memory, and then goes to our reasoning and thinking ability. The most common form of this disease is dementia. Some people may ask, what is dementia? Well, it's not a disease. It's just a general term for memory loss and other mental changes that inhibit daily living for an individual. Some individuals may suffer with personality and behavioral changes. Alzheimer's affects those 65 and older, but can also start as early as the age of 30. It affects 1 in 8 Americans over the age of 65. This disease was discovered by Alois Alzheimer's, hence the name Alzheimer's. He discovered this in 1906, and this was according to the article Alzheimer's Disease 2016. Secondly, I would like to point out some of the symptoms that a patient may exhibit while having this disease. In the article Aging and Mental Health, they noted that some of the patients that have been diagnosed with this disease have some of the following symptoms: agitation, delusional, hallucination, depression, irritability, and sleep disturbances. Lastly, I want to point out that there is currently no cure for this disease, but yet there are medications and therapy that can help an individual continue to live their daily lives. According to the article, Novel Strategies for Alzheimer's, there have been many double-blind studies to try to find a cure, but yet there have been no luck doing so. According to Therapies for Prevention and Treatment for Alzheimer's Disease, changes in your daily lifestyle, such as exercise, can help you reduce this disease. They had a small group that they did this study on, and they performed aerobics daily, and this helped this small group of participants that had Alzheimer's. It helped reduce their disease. I am very passionate about Alzheimer's disease. Not that I have anyone personally in my family, but that I worked at a hospital where I saw it take its toll on many families and individuals. And I hope that I informed you all about this disease. It is incurable. Don't forget to get out and walk and raise a cure for this disease on October the 7th. I have explained about Alzheimer's, what it is, who discovered it, and some of the symptoms and how it is treated. I'm going to leave you with the slogan from the Alzheimer's Association. Let's make Alzheimer's a distant memory.